Hello, welcome to my channel. So today we've started doing the contraceptive implant counseling. So the contraceptive counseling often actually features in OSCEs with the introduction of our legs or those who do USMLE, and it's therefore an important familiar. It's important to be familiar with the various types of contraception which are available. But specifically, we are going to be concentrating more or focusing on the contraceptive implants or just the implants in short. And also, we are going to talk about the common questions which are asked by the patients or the concerns which the patient might want to ask you, and the answers you'll be able to, you are expected to articulate, and how best to structure the consultation because you can't do everything jumbled. Okay, so this was our introduction. So how do you actually start the counseling? So of course, in starting the counseling, you have to start with the opening consultation, where of course you wash your hands, you do your own PPE if appropriate. Then finally, you introduce yourself to the patient, including your name and your role. So if you are to introduce yourself, you can say you are Mint Contraceptive Emerson, and your role is that you want to counsel the you have been tasked to counsel the same patient on the use of contraceptive implant, and so that's your name and your role. And of course, you have to confirm the patient's name and date of birth. Then, of course, you have to check the patient's understanding of the types of contraception available. So this is some of the things people usually forget. So assess the patient's understanding on the types of contraception available. It could be that they only have ideas on the implant alone. So just try to see if they have other information on the types available. And also, after they told you if they know the other types which are available, then explore the reasons why the patient wants the contraceptive implant. Like specifically, why do you want? There are reasons why you want the implants in short. Okay, so that was the opening consultation. So after the opening consultation, you go to ICE, which is ICE, ideas, concerns and expectations. That's the ICE. So the idea, concerns and expectations are actually important early in the consultation, as you may need to correct any misconceptions about the implant and address the patient's concerns as well. Then when exploring concerns, it is important to do so in a sensitive and honest manner. Okay, then it's also important to clarify the patient's expectations of the implant because if these are unrealistic, like what most of them are, of course, so you have to make sure you make the patient become realistic about what they want in short. So other forms of contraception may be better able to meet their needs if maybe they had wrong expectation about the implants. Okay, so remember in monkeys eyes. So eyes. So we are starting with I, which is the ideas. So ideas, you have to explore what the patient currently understand about the implant. So you can say, have you heard about the implants or the contraceptive implant? Okay, so if they have, then ask them like, what do you already know about the contraceptive, the implants ones? Okay, then they tell you. Okay, then that's the ideas you hear about the ideas they have. Then the concerns. So ask if the patient has any concerns about the implant. So how do you actually go about asking that? So there are a lot of ways to go about asking, and you are not limited to how I'm phrasing the questions. So you can just ask the same patient if there is anything that worries the same patient about the contraceptive implant. So ask, is there anything that worries you about the contraceptive implant or the implants in short? That's how you ask about concerns. Or other people find that they just ask, what are your concerns? But otherwise, they think it's more better to ask if there is anything that worries the patient. Okay, but just one and the same things. So, like I said, don't be limited to the phrases we are using here. Okay, and then expectations. So, expectations, that's the E. So, we have to explore the patient's expectation of the implant. So, we ask the patient, what are you hoping the implant can do for you? Okay, if they tell you that, then why do you think the implant is the best choice for you? Because they might have other expectations for a different type of contraception. Okay. Then you go to now, after you have done your introduction, open consultation, ICE, then the other thing is you have to now start to explain now everything. So the next thing I'm going to explain is what is the implant now? Like what is the contraceptive implant? So how do we explain it? You have to use patient-friendly language and explain that the implant is flexible, a plastic rod that is placed subdermally in the upper part of the arm. So what I've explained is just the same thing. So what we are going to say is just how can you phrase it? So you can just say, so the implant is a small plastic rod that sits just under the skin in the upper part of the arm. It is a long-acting reversible method of contraception and can be effective for up to 3 or 5 years. So depending on where you are using, depending on what we are using, that's why like I said we are introducing the types of implants in short. So I have to tell them one which are available. Okay, so there's one for 3 years and one for 5 years in short. Okay, then after you have explained what the implant is, you are going to talk about so those who want specifics, you can even tell the patient to say, okay, we have 2 types, even on the before you even tell them about how they work. So since we mentioned 3 years and 5 years, we can say, okay, we have the Jadel, which is for 5 years, we have the no plant, which is for 3 years. Then go out, explain out, then go now to explain how they work. Okay, so how do the implants work? So that's the next step. So I have to explain that the implant primarily works by preventing ovulation. However, it also thickens the cervical mucus and thins the endometrium. Now, this is not patient-friendly language. So how will you explain to the patients? This is your stuff. So can you explain this to the patient? So you say, okay, so you see, the implant stops an egg from being released from your ovaries. So we have explained the preventing ovulation part. Then it also thickens the mucus in the neck of your womb and thins the lining of your womb. So this can make it difficult for the sperm to reach an egg and make it less likely for your womb to accept a fertilized egg. So that's how the implants work in a patient-friendly language. Okay. Then after I explain how they work, you have to explain how effective the implant is. So how effective is it? So often patients want to know how effective contraception is, as this can help guide their decision on which contraception to use. So it's useful to know some basic statistics on efficacy. So like I said, so before you even begin to counsel someone, you have to have the data. In short, you have to know about the pair index of contraception. So if you are unsure, then you have to signpost the patient to a reliable source and don't guess. If you don't know, just tell them you don't know. You will say, currently I don't have the information right now, but I'll just more like I post you to tell you some reliable sources and where you can check the efficacies. Or you can just tell them, okay, so if you don't have anywhere you can check, you can maybe tomorrow, or since it's an host station, you can just tell them that, okay, next time I'm going to tell you the actual ones after I go and confirm, or you just tell them, but it's more better since it's an OSC station or it's an OSC exam, practical one. So you can just tell them, say, okay, I can just, give you this source and source, so that we'll go and check from there in short. Okay, so the implant is 99% effective, and less than one implant user in 100 will get pregnant in 1 year. So remember, like I said, we are using the PEO index, so that's how effective it is. Okay, but remember, I have to go through the PEO index because they have their own percentages. Okay, so advantages and the disadvantages. So we have explained how effective it is. So now explain to the patient the advantages and the disadvantages. So always give patients as much information as possible so that they can make an informed decision. So it is useful to do this by discussing the advantages and the disadvantages of choosing the implant. So you tell the patient that if it's okay with you, I would also like to tell you about the benefits and disadvantages of the implant. Then hopefully you will have enough information to make a decision. So remember, we have started if it is okay with you, meaning if the patient is comfortable with what you have discussed from earlier on, and they would like to proceed to other things, because you want the patient to more like to be understand, to be going so that we'll be going forward with the patient, not the patient has remained behind on how effective they are. Then you even add the data for advantages and advantages. So it's always to ask if the patient is okay, we can proceed, or if they have any questions from what we have discussed. Okay. So bearing in mind what we have said on advantages and disadvantages, so we start with the advantages. So we can do the opposite, but okay, here we are starting with the advantages of the implant. So of course, these are long-term contraception. So in short, they remain effective for up to depending on the type, up to 3 or 5 years from the date of insertion. Then the other advantage is that they can be reversed easily. So as soon as the implant is removed, fertility should resume as normal. So that's how the advantage is. Okay, then they may make periods less heavy and painful. So that's also another advantage. Then they're actually safe to use in breastfeeding. So if they wanted to have this implant when they have a breastfeeding baby, you can tell them, okay, with this type of contraception, it's fine for you to even more like breastfeed, in short. Okay, then the disadvantages. So, but please note that these are not the only advantages. There are lots of advantages. Okay, but we just picked out some few. Okay, then disadvantages of the implant. To say we have unpredictable periods. So they are, in short, they are irregular periods, longer lasting periods, or no periods at all. Those are some of the disadvantages. And the other thing is they have possible temporary side effects such as headaches, breast tenderness, and mood changes. But remember, normally these last for no longer than a few months, in short. Then the other disadvantage could be acne, where some people find that they may develop acne or have worsening of their acne after insertion of the implant. Then the other disadvantage is that actually there is need of a small procedure which is required. So a simple procedure is required to insert and remove the implant. So we are going to say, I will go on to explain this later in the consultation. That's what you actually tell them. So okay, one of the disadvantages is that there is a small procedure which is required, but this procedure is required to insert and remove the implant. But I will go and explain how we actually do this as we move on to the disadvantages. Okay, then you go to the disadvantage to say, okay, so it also does not protect against STIs. So meaning they have to actually get barrier contraception, the condoms, as some form of contraception that provides protection against STIs, in short. That's what you actually tell them. Okay, so there are some risks of the implant, especially when used or during insertion or after insertion. So there are some risks which are available or which occur. We have one, infection. So infection usually happens during the first few weeks after an implant is put. However, we tell the patient to say, okay, we are going to take appropriate steps to reduce the chance of an infection developing. In short, we are going to do appropriate things. In short, you have to sterilize, you have to disinfect, those things, in short. Okay, then the other risk is bruising and bleeding. So again, it's common to have a small amount of bleeding during the procedure, and the pressure will be applied to minimize this, in short. So tell the patient that you most likely develop a bruise which may be large and extend down your arm as a result. So as a result of small amounts of blood leaking under your skin. So although this might look concerning, these bruises typically fade over the following week or so. So that's how you tell the patient about bruising and bleeding. Then you have damage to local structures. So how do you tell the patient that? So as there's some risks involved. So tell the patient that, okay, I'm going to carefully insert the implant in a location that isn't close to any large blood vessels or nerves. However, if there is a very small possibility that some of your blood vessels or nerves or muscles can be damaged during the procedure, Okay, so that's how we tell the patient about damage to local structures. Then the other risk is breast cancer. So there may be a slightly increased risk of developing breast cancer compared with people who do not use hormonal contraception. Okay, that's why we have explained the advantages and the disadvantages in short. So that was part of the disadvantages. Then we now explain the procedure, like how is the implant inserted. So it is also used to explain the process of inserting an implant using a before, during, and after structure. So when explaining, just bear in mind that, okay, I'm going to explain the before, during, and after the procedure. So because this is going to help you remember the key points for each step. So we are now on the before part. So before, you can have the implant fitted at any time. That's on the before. So we tell the patient that you can actually have the implant fitted at any time during your period. Firstly, what I'm going to do is that I'm going to use a needle and a syringe to administer a small amount of local anesthesia to numb the relevant area of your arm, so that you want more like during the insertion of the implant, so that you don't feel any pain, or so that you don't feel any pain in short. Then you also say that you are, of course, you are going to experience a tingling, a stinging sensation when the local anesthesia is injected, because we are using a needle, so it's going to sting, of course, but this should fade quickly. That's how you tell the patient. That's the before part, they explained before. Then during, so you see the implant is the size of a matchstick, and what I'm going to do is that I'm going to insert the implant into the skin, and it should not take more than a few minutes in short. Okay, then after the procedure, that's the after structure. So tell the patient, say, okay, I'm going to show you how to feel for the implant to make sure that it is in place. Then the area where the implant was inserted may be slightly tender, bruised, or swollen for a couple of days following the procedure. But it is important to try to keep this area clean for the next few days to help prevent infections. Okay, so that's how you actually explain. You actually explain how to insert the implant. Okay, so we have explained how it is inserted. Then the other thing you have to explain is how it is removed. So of course the implant can be kept for 3 or 5 years, depending on which one the patient has chosen. Then if you decide, but remember, these OSCEs or these practical exams also can actually be, or the patient might actually want the one for 5 years. So meaning you won't be mentioning to say, okay, for 3 or 5 years. So for you are just going to be saying, okay, this one for 5 years, because if the patient has chosen Jadeo, meaning you can tell them about the one for 3 years, of course they're going to pick the one for 5 years. But meaning you have to actually, even your consultation will actually be focusing on the one for 5 years. Okay, so if you say this implant can be kept for 5 years or 3 years, but if you decide you do not want it, a trend like I'm going to remove it again, in short. So just like with the insertion, you'll be given a small a local anesthesia injection, and a small cut will be made in your arm. Then this implant will be removed through this. Then the implant is going to be removed through this same procedure, and this should only take a couple of minutes as well. So of course there can be some difficulties removing the implant. So if this is the case, you are going to be referred to a center where we can remove it with the assistance of an ultrasound scan, in short. So more like it's more of a specialized center, in short, that more like you just explain to the patient that if I was to fail, okay, we can take you somewhere where we have a specialist center to remove it with the assistance of an ultrasound scan. So meaning the ultrasound guided. Okay, so then you are done with the consultation. So closing consultation. So how do you close the consultation? You have to summarize the key points back to the patient, then ask if the patient have any further questions or concerns that haven't been addressed. So throughout the consultation, you should check the patient understanding at regular intervals. So that's, remember, like I said, before we move on to a lot of things, make sure the patient understands what we have already gone through. So using phrases like Can you just repeat back to me what we have just discussed regarding maybe advantages and disadvantages, or regarding insertion? Okay. Then it also may be useful to direct the patient to any website or reference with further information. Like I said, evidence and posting is actually very important. Okay. Then offer the patient time to consider their decision. Don't rush them. Okay. Then you have to encourage the patient to use condoms if they are not currently using any contraception. Of course, then you thank the patient for their time. You dispose of the PPE appropriately and also ends. Okay, so we are done with the consultation. So the next thing we can talk about is common patients questions. So, or if it's an exact kind of an exam setup, the examiners might give the same person you are examining these same questions. So what are the common patient questions? So they can ask you to say, can medications impact the effectiveness of the implant? So now, as a medical practitioner, going to say, okay, the implant is affected by enzyme-inducing drugs such as barbiturates, carbamazepine, phenytoin, rifampicin. So, of course, that's why it's important to check the patient's medical history. It should be checked prior to being commenced on the implant. So the patient should also be told to make their clinicians aware of their implant before starting a new medication, in short. So the other question is, will the implant still work if I have diarrhea or vomiting? So of course the implant is not affected by vomiting or diarrhea. So these are just address the patient's concerns, in short. And the other question is, how will the implant affect my periods? So remember, like we have talked about on the advantages. So it is likely that the implant will experience, it's likely that the patient will experience changes during their menstrual cycle. Some experience irregular and unpredictable periods or longer lasting periods, whilst others find that their periods stop completely, in short. So those are some of the things the patient might ask you. Okay, but these are not the only questions the patient might ask you, so just have to bear in mind to have the data and make sure you go through the pair index, in short. All right, thank you for watching. If you haven't subscribed, subscribe and hit the bell notification and check out other videos. See you on the other tutorial.